All right, everyone get ready because today we are taking a deep dive into diabetes and dental care.
Oh, yeah.
Buckle up.
This should be a good one.
It's going to be a fascinating one.
It is.
We are focusing specifically on how high blood sugar or hyperglycemia complicates the heck out of things.
Yes, it does.
So think of this deep dive as like your crash course into what dentists have to think about when they're treating patients with diabetes. We've got excerpts from medical textbooks on oral surgery,
Okay.
infections,
All right.
and even a bit on pre-prosthetic surgery.
Sounds intense.
It is, but we're going to make it fun.
Very cool.
So
I'm excited.
I am too.
Yeah.
Let's jump right in.
Okay.
How does hyperglycemia, actually complicate dental care?
Well,
I mean, why is it such a big deal for dentists?
one of the biggest things is delayed healing.
Oh, really?
When blood sugar is high, the body's ability to repair itself is compromised. And that's like after any dental procedure, whether it's big or small.
So even like a simple filling could take longer to heal.
Yes. If someone has uncontrolled diabetes.
Yes, and that extended healing time then leads to a higher risk of infection.
Oh, okay.
And we're not just talking about like a little bit of gum inflammation here. People with diabetes are susceptible to some pretty serious infections,
Oh, wow.
including ones that can spread to deeper facial spaces.
That sounds pretty intense.
It can be.
Can you give me like an example of what that might look like?
Yeah, so imagine an untreated tooth infection in a diabetic patient.
Oh.
So what starts as like a very localized problem can then escalate into what's called a deep cervical fascial space infection.
Oh.
So it spreads from the tooth down the neck and can potentially impact vital structures.
Oh, wow.
And in like extreme cases, it could even require a tracheostomy.
Oh, gosh.
Yeah.
So that's a surgical opening in the windpipe
Exact.
to help them breathe.
Yes.
Gosh, that's a really scary thought.
It can be.
And a powerful reminder of why managing blood sugar is so important.
So what are dentists doing to kind of minimize these risks during treatment? Are there special strategies that they use?
Absolutely. Meticulous oral hygiene is always the first line of defense.
Okay.
But for diabetic patients, it's even more critical.
Makes sense.
So before any procedure, dentists need to gather specific information like blood sugar levels,
Okay.
what medications are they on, and even when they last ate.
Really?
Yeah.
Wow.
They need like a complete picture of the patient's health status before they start any work.
Yeah, you don't want any surprises mid-procedure.
No, not at all.
So, but what happens if a patient experiences a hyperglycemic episode? Like in the chair?
That does happen.
I mean, it just seems like that would be a recipe for disaster.
Well, dentists are actually trained to handle a range of medical emergencies.
Oh, okay.
So they need to be able to quickly differentiate between something like hypoglycemia, a stroke,
Wow.
or even cardiac issues,
Okay.
all of which can present with similar symptoms.
So they're like mini ER doctors in a way.
You could say
Well,
that one of the sources describes steps for handling a syncopal episode.
Syncopal episode.
Yeah, or fainting spell.
Okay.
One detail that stuck with me was crushing an ammonia ampule
Oh, yeah, I remember that.
under the patient's nose to try to stimulate consciousness.
It's like a scene out of a medical drama,
Yes. Intense.
but fascinating.
It's pretty wild.
It is.
It highlights the importance of dentists being prepared for anything,
Right.
especially when treating patients with diabetes.
Okay, so dentists are on high alert for these hyperglycemic episodes.
Yeah.
But let's talk about the long-term complications
Okay.
that can arise from uncontrolled diabetes.
All right.
One that I came across and it really caught my eye was MRONJ,
Yeah.
medication-related osteonecrosis of the jaw.
That's a mouthful.
It is a mouthful. It sounds pretty serious.
It is serious.
What is it?
So MRONJ is a condition associated with certain medications used to treat diabetes like bisphosphonates, which are often prescribed to strengthen bones.
Okay.
The problem is, in some cases, they disrupt the normal bone remodeling process in the jaw, potentially leading to exposed bone that doesn't heal properly, especially after a dental procedure.
So even medications that are meant to help
Right.
can backfire
They can.
in these unexpected ways.
Unfortunately, yes.
Wow.
And MRONJ can be painful and lead to further complications like infections.
Oh, no.
It really reinforces the importance of open communication
Uh-huh.
between the patient, their doctor, and their dentist.
Right.
Everyone needs to be on the same page about medications and potential risks.
Absolutely. Yeah, communication is key.
It is.
Yeah.
Even something as routine as like a dental cleaning can be more complex for someone with diabetes.
Oh, really?
Yeah.
What makes it so different?
Well, for starters, people with diabetes, they tend to have more plaque and tartar buildup,
Okay.
which can increase their risk of gum disease.
And we already know that uncontrolled diabetes can really delay healing. That's a recipe for trouble.
Yeah, so dentists need to be extra meticulous with cleaning
Uh-huh.
and may recommend more frequent checkups just to stay ahead of any potential problems.
So it's all about prevention and early intervention.
Absolutely.
Got it. Okay.
And speaking of prevention, let's talk about dental implants.
Okay.
They're a popular option for replacing missing teeth,
Yeah.
but diabetes adds another layer of complexity.
Right. Implants, I've heard they're kind of a big deal.
Yeah.
What's the main concern for someone with diabetes?
It all comes down to that pesky delayed healing again.
Oh.
So for an implant to be successful, it needs to fuse with the jawbone,
Ah.
a process called osseointegration.
Wow. Osseointegration.
Yeah,
Big word.
it is a big one.
Okay.
If healing is impaired, that fusion might not happen properly and the implant could fail.
So it's kind of like trying to build a house on like shaky ground.
Yeah.
It's not going to be stable.
That's a great analogy. So dentists have to take extra precautions when placing implants in patients with diabetes,
Okay.
like minimizing trauma to the bone during the procedure
Okay.
and using copious irrigation to cool things down and prevent overheating.
Irrigation, is that like watering a plant?
Kind of, yeah. It's a sterile solution that helps create the optimal environment for healing.
Wow. Fascinating.
Yeah,
So it sounds like dental implants are still a viable option
they are.
for people with diabetes, as long as their dentist is aware of the challenges and takes those necessary steps.
Exactly.
Okay.
And there's another tool that's becoming increasingly popular.
Okay.
Surgical guides.
Surgical guides, what are those?
Think of them as blueprints for implant placement.
Oh, okay.
They help dentists position the implants with incredible accuracy,
Wow.
ensuring that they're in the ideal spot to support the replacement teeth and create a natural-looking smile.
So they're like GPS for dental implants.
Exactly.
Yeah, it's like, hey.
Surgical guides are especially helpful for patients with diabetes because any misalignment could increase stress on the bone and hinder healing.
Right. It's all about minimizing that risk and maximizing the chance of success.
Couldn't have said it better myself.
Okay.
Now let's switch gears again and talk about antibiotics.
Okay.
Another area where diabetes throws a wrench into things.
Antibiotics, what's the connection there?
Well, dentists have to be incredibly cautious about prescribing antibiotics to patients with diabetes.
Why is that?
Overuse of antibiotics can lead to antibiotic resistance,
Uh-huh.
which is a huge problem.
Right.
And so we want to make sure that those antibiotics are effective when they're truly needed.
Makes sense. So it's a balancing act between treating an infection
Right.
and preventing like a bigger problem down the road.
Exactly. Dentists have to carefully consider the severity of the infection, the patient's overall health status,
Okay.
and any potential drug interactions.
Right.
Some antibiotics can interfere with diabetes medications.
Wow.
So it's really a team effort between the dentist and the patient's physician to determine the best course of action.
Got it.
Okay, so we've covered implants,
Uh-huh.
antibiotics.
Yep.
Is there anything else that kind of stands out as being particularly challenging?
Yeah.
When treating patients with diabetes?
Yeah.
You know, one area that often gets overlooked is salivary gland function.
Salivary glands, those are the ones that produce saliva.
Yes,
Oh.
saliva is essential for oral health.
Uh-huh.
It helps neutralize acids, wash away food particles, and lubricate the mouth.
Yeah.
But people with diabetes often experience dry mouth,
Oh.
also known as xerostomia.
Okay. Why does that happen?
It's not entirely clear,
Okay.
but it might be related to high blood sugar levels
I think
or
so, too.
certain medications that are used to manage diabetes.
Got it.
And dry mouth can lead to more problems.
Oh, really? Like what?
Yeah, it increases the risk of cavities, gum disease, and oral thrush.
What is oral thrush?
It's a fungal infection.
Oh, that doesn't sound pleasant.
It can be quite uncomfortable.
Okay.
Thankfully, there are ways to manage dry mouth. Oh, good.
Like using artificial saliva products,
Oh, really?
staying hydrated, and avoiding sugary drinks.
Okay, so even something as simple as saliva production can be affected by diabetes.
It can.
It really highlights how this condition impacts the entire body,
Yes, it does.
not just blood sugar levels.
It's a systemic disease, and its effects can be far-reaching.
Wow.
That's why a holistic approach to healthcare is so important for people with diabetes.
It sounds like it. We've been talking a lot about the challenges that come with diabetes and dental care. But what happens if someone with diabetes, like, experiences a facial injury?
Oh, yeah.
Does that complicate things even further?
Absolutely. Imagine someone with diabetes has a jaw fracture
Okay.
or a cheekbone injury.
Uh-huh.
Their ability to heal from that trauma is directly impacted by their blood sugar control.
Right, because we know uncontrolled diabetes can delay healing, and that's a big deal for any injury,
Exactly.
especially facial trauma.
Yes, the source material even mentions specific types of facial fractures, like Lefort fractures.
There are a classification system for fractures that involve the midface, and they can be pretty serious.
Lefort fractures, those sound intense.
They often involve multiple bones
Yeah.
and can even impact someone's ability to breathe, speak, or even see properly.
Oh my gosh.
Yeah.
So if someone with diabetes experiences a Lefort fracture,
Mhm.
what are the implications then for their dental care?
Well, dentists have to be incredibly meticulous, especially with infection control.
Right.
Any contamination could further delay healing and increase the risk of complications.
Makes sense.
They also need to work closely with the patient's physician
Yeah.
to manage blood sugar levels and optimize their overall health.
It's another example of how that holistic approach is crucial for people with diabetes.
Absolutely. And speaking of a holistic approach, let's talk about another area where diabetes can have like these unexpected consequences:
Okay.
nerve damage or diabetic neuropathy.
I've heard about neuropathy. Isn't that when nerves get damaged, often in the hands and feet?
That's right. But it can also affect nerves in the face.
Really? I hadn't even considered that. So how does facial neuropathy then impact dental care?
It can cause numbness or tingling in the mouth, making it difficult for patients to feel pain or temperature changes,
Ah.
which can lead to accidental bites or burns.
Oh, no.
And it can even make it harder for dentists to administer local anesthesia effectively.
Oh, wow. That sounds like a tricky situation
It can be.
for both the patient and the dentist.
Yeah, dentists need to be aware of the signs and symptoms of facial neuropathy
Okay.
and adjust their approach accordingly.
Makes sense.
They might need to modify their anesthesia technique or take extra precautions during procedures to prevent injuries.
As we've been diving into these sources, I'm really amazed at how much detail goes into dental surgery, especially when you're considering conditions like diabetes.
Yeah,
The source material that we have mentions different types of nerve injuries.
it does.
Can you kind of give us a quick overview of those?
Sure, it breaks them down into three main types: neuropraxia, axonotmesis, and neuromesis.
Those are some big words.
They are, but I can explain them simply.
Okay, thanks.
So, neuropraxia is the least severe.
Okay.
It's like a temporary disruption of nerve function, but the nerve itself isn't damaged.
It's kind of like a brief power outage.
Exactly. Then there's axonotmesis,
Okay.
where the axon, the long part of the nerve cell that carries the signals, is damaged.
Uh-huh.
However, the protective sheath around the nerve is still intact.
Okay, so there's hope for recovery there.
Yes, the nerve can regenerate over time.
Okay.
The most severe type is neuromesis,
Okay.
and this is when both the axon and the protective sheath are completely severed.
Oh, that sounds a lot more serious.
Nerve regeneration is unlikely,
Wow.
and surgery may be needed to try to repair the nerve.
Wow, it's amazing how much can go wrong, but also how resilient the body is.
It is remarkable. The source material even talks about Wallerian degeneration,
Okay.
which is a process that happens when a nerve fiber is cut or crushed.
Okay.
The damaged part of the axon breaks down, clearing the way for potential regeneration.
So it's like the body's way of cleaning up the mess and making space for new growth.
Exactly, and it's a reminder that even in the face of serious challenges, the body has an incredible capacity for healing.
I think you're right. This deep dive has been a real eye-opener.
Yeah.
We've gone from basic dental hygiene to facial trauma to nerve damage and even the molecular level of how nerves work.
It's been quite a journey.
It has. And I think a key takeaway for me is that for people with diabetes, dental care is about so much more than just teeth.
It is.
It's a crucial part of managing their overall health.
Absolutely.
So if you have diabetes, remember, open communication with your doctor and your dentist is vital.
Yes.
Don't be afraid to ask questions and be an active participant in your care.
That's great advice. Knowledge is power when it comes to managing any health condition,
It is.
especially one as complex as diabetes.
Well, that wraps up our deep dive into diabetes and dental care.
Thanks for tuning in.
Thanks for joining us. Until next time, stay curious and keep learning.